Today, I want to talk about the principle of consent. Consent has been an important part of medical practice ever since doctors were invented. The principle is that any person receiving a treatment or a procedure needs to have adequate information to figure out if that procedure or investigation is correct for them. And this is especially important in a vaccination program, and especially important when everything is new. So, before a procedure is undertaken, in this case having a jab in your arm, information needs to be given to you in a way that you can understand, and you need to have time to ask questions. In a vaccination program, consent begins as somebody books an appointment. In this case, anybody who's booked into the NHS COVID-19 vaccination program will be sent information regarding the vaccination and the procedures as well. You should read this information carefully if it's sent to you electronically by text or posted to you. And it's important to get this information across to you prior to standing in the queue for your vaccination, because, quite frankly, when you're doing a vaccination program, a lot of people need to be jabbed very quickly. But at the same time, we need to balance this against your right to ask questions at the time. So when you go for your COVID-19 vaccination, be aware that you have an opportunity to ask questions of the person giving you that vaccination, but also be aware that there are many people in the queue behind you. Thankfully, for the majority of people, the process of consent is fairly easy, but for many people, the process of consent can be quite tricky. For example, people who lack capacity, those with learning disabilities or dementia, people with communication difficulties such as hearing or sight loss, or people with severe mental health problems where there are alterations in the way they think or the things they believe. We are hoping that when the vaccination programme begins in earnest in Tameside and Glossop, things will run very smoothly. But this is all new to us. And so, if you find there are some delays when you turn up, be aware that the first cohort of patients being jabbed are those over aged 80, often with mobility problems, perhaps communication difficulties such as hearing loss, and also maybe some difficulties understanding the consent process. It's only with understanding, patience and compassion that we're going to get through this vaccination programme smoothly. And I have every faith that the people of Tameside and Glossop will act as an amazing team and help out.